Hello, everyone, and welcome to our webcast. We're so delighted to have your attention because it's not too late to get your flu shot. And I think after you hear this guest panel speak, you will feel very motivated about moving forward and making sure you, your loved ones, your patients, your community have the benefit of that protection. Here's our agenda. So we're starting out with some introductions, which I will do. And then I'm going to give a little background. But here are the questions we'll be having our panelists address, and then we'll close it out. In the way of introductions, here's what our NMQF Live webinar is called, Driving Equity in Flu Vaccination, especially geared to our Georgia friends. I am the founder and president emeritus of NMQF Center for Sustainable Healthcare Quality and Equity. And we are very blessed to have these two panelists. So let me tell you a little bit about Pastor Hamner. You see here, I have his bio. He's a very distinguished man. We're so lucky to have him. Been preaching and leading in his Christian vocation for 30 years now or more. He hails from Buffalo, New York, but I think he's been doing most of his work really since 2013 in churches in Georgia. I don't want to read through all of his accomplishments, but you can see here how lucky we are to have him as a leader and a panelist today. Dr. Michelle Cook is a rock star in her own right. And you can see, this is not my words, these are the words I found in her bios online. She's a rock star family physician. She's a wife, boy mom, yogi, a proud direct primary care physician. She is the owner and founder of Southwest Atlanta's first DPC practice, Soul Direct Primary Care. So really addressing all of a patient's needs. And you see here her educational background. Castle Connolly top doctor last year. So I thank both of our prestigious panelists for their time and their advocacy and their leadership. SHC, the Center for Sustainable Healthcare Quality and Equity, is a part of the National Minority Forum, which I just mentioned. And we really have a vision of connecting the dots across more zip codes. That is, connecting people of color and underserved populations to health and health care. And so our mission is to really promote sustainable, healthy communities in every zip code through clinical and community engagement. Here's the team. Been so fortunate to work with. I noted that we work with clinicians, so that's the DRIVE program, which I'll talk about a little bit. But we also work with community leaders, folks in churches, barbershops, hair salons, and other advocates and champions for health equity around the country. The Faith Health Alliance is probably our most really growing and amazing network of 30 plus churches around the country. And Pastor Hamner is leading networks within Georgia, many networks of churches to promote health and health equity, flu vaccination in this case. We also work in partnership with Dr. Stephen Thomas at the University of Maryland with a network of barbers and hairstylists who promote health equity in their client base and their communities. They're really dedicated to their network and their clients. Finally, I would point out we work with pharmacists around the country, more than 140 at this point, who are very well educated in the clinical space to provide a lot of education as well as services. And we work with them to help them connect with underserved community leaders so that they can bring their knowledge to the community. So let me set us up for the conversation by reviewing some of the data that we have concerning the flu. So we're in the 2023-24 flu season. Flu activity is elevated. Here's the CDC estimates there have been at least 10 million flu illnesses, 110,000 hospitalizations, and 6,500 deaths so far. And I looked at their update today on their website. The CDC recommends that everyone 6 months and older get a flu shot every year, as long as the viruses are spreading. And believe me, they can still provide benefit this season. They also want to remind us of the treatments for flu that can be very helpful, especially for older people and people with chronic conditions that make them more vulnerable. So here's our national data. I think this is as of January 12th. Red is this year. And as of the 12th, it's coming down a little bit. But as you can see from previous years, coming down a little bit doesn't mean it's over. I'm pointing to previous years. So this map shows you where in the country rates are high. And you can see that your state, Georgia, has high rates of flu. So this is ending on January 6th. So the purple and the deep red show the highest rates of flu. I just wanted to call out to you. So this is our current year, 23-24. And retail means pharmacies, and medical means the clinical office. And I think you can see that flu season vaccine claims are down this year. And they're down in both the pharmacy space and especially in the medical office space. So something to be aware of. Let's look at flu vaccine coverage. I don't think that we're doing too well here in Georgia. This is from the end of the year. There's not more recent data than this. This is all adults, I believe. You can find all of this data on the internet at the CDC website. So let's talk about flu vaccine coverage among adults this year. 43.8% at this point in time, with a big range, 31 to 54%. Huge disparities by race and ethnicity, as you can see here, 48% versus 33, 35, 38% among American Indian and Alaskan Native adults, Hispanic adults, and Black adults. That's a gap that has persisted for decades and maybe is bigger this year. Rural areas have lower rates of vaccination. Young people tend to have lower rates as well, and people in poverty do. So let's look at Georgia a little bit. I just took some headlines out of the Atlantic Journal-Constitution. The latest flu numbers, this is from January 5th, I believe. The latest flu numbers in Georgia prove it. More and more of us are sick. Flu activities reached very high levels in Georgia. The state's latest report shows a higher level of flu illnesses in early January compared to this time over the past 3 years. Again, this is January 5th. And the percentage of people going to the doctor for flu-like symptoms has reached more than 10% of all visits. And I'm sure that Dr. Cook will have something to say about that. Your rate of visits for flu-like illnesses, similar to the national trend. This is this year. Similarly, here's another indicator of flu season. So you can see from this slide that COVID's also out in the public. In terms of the rates and hospitalization and deaths, been going up, maybe is steadied this week. And the rates of COVID vaccination are really quite low. Now at NMQF SHC, we actually have a toolkit for clinical teams to improve their rates of vaccination, flu vaccination, and health and equity in flu vaccinations. I'm not going to walk you through every step. It's based on a simple rapid improvement model. It relies on a couple of champions in a practice who really are dedicated to helping their patients avoid flu by getting vaccinated. It provides tools to really understand your practice and your patients and your community so you can figure out how best to improve your rates. It has other tools that you can design something that you want to do in your practice. It can be very simple. And we believe very much that it's critical to share your work, your progress, your results with your clinical team, to and to let your patients, your leadership, your community know about your commitment to promoting health equity and protecting patients from the flu in this instance, and celebrate your clinical staff who really do so much for your patient population. So that's the DRIVE program. We have a library of things that you can do. As you saw from the data, rates of vaccination are not great, and it is not too late to vaccinate. I think people forget that January, February, March, really you have benefits that accrue to the patient by vaccination at the late season. And specifically, you can look at your vaccine rates among your patients of color or your patients with chronic conditions. So you know who hasn't been protected yet to date. You can send out text or patient portal information to your patients about getting the flu. And I threw in COVID vaccine. You can do something as simple as put posters in your office. That has a impact on the patients who come in. And you can engage with community leaders like our pastor in this program who want to do community-based vaccination or at least education of their congregants and community. So these are all things that it's not too late to do to improve the protection of your patients. So these are the questions that Dr. Cook and Reverend Hamner will discuss. I'm going to take this off screen and really just pose the question for them to respond to. So let's go to it. And you see we have our folks here. So let me ask you both either why you think we need to pay attention to flu vaccine equity.
Well, I'll take that. Thank you for having me. And it's my joy to participate with this program and this discussion. I think equity in terms of flu vaccination certainly coincides with the need for equity in healthcare in the African American community all across the country. I think by default, as we talk about prohibiting these kinds of communicable issues and illnesses, it is an injustice, if I could say it that way, for our community, Black community, to remain underserved in this regard, as it is already underserved in so many regards. So what the Center for Health Equity does, as well as all the participating entities to help bring equity across the board is vitally important for us.
Thank you. Dr. Cook, do you have any comments about health equity in vaccination?
Absolutely. Thank you, Dr. Lorley, and thank you so much, Pastor Hammer, as well. I agree with everything the pastor just mentioned. I would add that equity is so important because the burden of disease, general disease and illnesses, are very disproportionate in the Black and minority community. Flu does not have to be a deadly condition, and in fact, for most people, it is not. You feel horrible, terrible symptoms. It will keep you out of work, so it has a lot of impact, but it doesn't have to be deadly unless you have comorbid conditions. So if you're dealing with hypertension, you're dealing with diabetes, you're dealing with COPD, which is disproportionate in our community, now it becomes a very deadly disease. It's something that puts you in the hospital and something that can cause death. So almost we need more than equity. We need a boost of vaccination in this community because they are so underserved, because this illness that does not have to be deadly becomes a much more deadly force in our community.
Thank you so much. I think that's a very important point. I'm going to move around a little bit because I want to get your sense of why there might be challenges in promoting flu vaccination generally in Georgia, and especially among people of color. Maybe Dr. Cook, can you start with that question?
It's a loaded question, and there's so many ways that you can answer it. I think the greatest issue, or I think there's two issues. The first issue is access, and the second issue is trust. So I think nationally, but particularly here in Georgia, we have a huge problem with access. On the chart you just showed, you showed how vaccination in the primary care space or the clinical space has decreased. And a lot of that, I would think, and I'm extrapolating here, is because access to the clinical space has decreased. We have poor insurance rates here in Georgia, so people can't always access a doctor. In the community where I am, and the reason I started my practice is because one of the largest health organizations closed and closed multiple primary care offices with it. So last year, this time, we had 6 more primary care offices that people could access that simply are not there. So the people that would go to their doctor to get their flu shot can't get there anymore because the offices aren't there. I love that the pharmacies are taking some of the lead and helping to be leaders with getting flu vaccination out there, but that's very patient. The patient must be the advocate. They have to walk in asking for a flu shot. Whereas when you're with your doctor, you can kind of have a natural conversation. You can inquire. You can ask about hesitancy. You can ask about the things that stop patients from getting vaccinated and then offer it. Whereas I think you need a much more motivated patient to go to the pharmacy. The second piece I'll speak about briefly is just trust in the system. Our Black and minority community has been truly harmed in medical care, and we can't ignore that fact. There has been harm that has been done to this community in the name of medical care. And I think people have the right to have some hesitancy and some discomfort with accepting a therapy, with accepting an injection into their bodies that they don't, from a system that they don't largely trust. And so you need to have faces that can offer trust and support and answer those difficult questions that talks about why we need to trust this and why it's to our detriment not to be involved with getting your flu vaccination.
That's a good segue to you, Pastor Hamner, about building trust. What do you see as the barriers for flu vaccination among people of color?
Oh, I think Dr. Cook is spot on. Those two aspects in terms of trust and access. I probably would, if I can, just hang on to the second thing she mentioned, which was trust, and being able to build trust in our communities. I think that a part of the part that the church plays or church leadership plays is vitally important in that regard and in that respect, helping to build trust in our communities. And people like Dr. Cook, of course, help in that regard, because Dr. Cook looks like the people that I pastor. And so historically, the trust issue in our community for the medical community has been very, very vibrant over time and over the years. And it's just something I believe that we have to keep trying to chip away at. And every time we are able to get somebody vaccinated, and every time we're able to get another somebody vaccinated and another somebody vaccinated, it just helps everything grow, and it helps people across the board gain trust, at least in some regard, for the vaccines.
I thank you for that. We have certainly seen in our survey of pastors in the Faith Health Alliance that they think the 3 biggest issues have to do with, well, I'll just mention it as 2: education about the issue. They don't really know the risk posed by the flu, and not just for themselves, but their family, or missing work, or their community. And secondly is trust, as you said.
Mhm.
So, advocates like Dr. Cook and community leaders who are trusted like you, Pastor Hamner, I think are critical. Um, so I'm going to ask you both to kind of walk us through how you individually are trying to close this gap and protect the people you serve. I'll start with you, Pastor Hamner. So, what are you doing at your church and in your community and with other churches to promote flu vaccination and protection among the congregants and community?
Well, the great privilege that I have, Laura Lee, in being a part of this group is allows me to of course, touch other pastors and speak to the issue of vaccines, flu vaccines, in conversation and education, but not just education and conversation. The fact that we have the resources available to lend to those pastors or come alongside and assist pastors with events and vaccinations certainly proves to be extremely helpful. As for our church, Reset Church, and other ministries that we've touched here around the city of Atlanta, there have been various events that people have coordinated. Pharmacies or pharmacists have come in and participated in those events, and many people have received flu vaccines at those events. We personally, our church did a food giveaway and dry bread giveaway, had vaccines available, and we saw somewhere near 50 people, I believe, receive vaccinations on that one event. Other events that have been hosted, it's been that number or close to it or more. And so as we move um, as a group, as we move in this synergistic effort, if I can call it that, I think everybody, as we play our parts, helps for the betterment of our community at large as we make these vaccines available. So it's been really enlightening. It's been enlightening. It's been fun. It has been very good to be able to just touch people on this level. Myself, along with a couple others who are part of the group, had an offline discussion about how we are incorporating, healthcare Sunday or something to that effect, in order to keep in front of the people the need to address healthcare issues, particularly with this group, flu vaccines and that type of thing. And it's been really great. It's always wonderful in our business to see the light come on for people and it become transformational for them. So
I'm so happy to hear you talk about it being fun because I firmly believe that pastors and doctors and their teams, they got into the business they're in to help people. And so when you put a little bit of resource around that and connect them, it is fulfilling. It kind of, you're not so burnt out because being reminded what's really important. I think you've been a little modest, Pastor Hamner, as well. I believe you've organized 12 other churches in this activity, which
who's
is
counting?
big.
Who's counting? We just keep it going. We just try to keep it going.
It's wonderful because we can work together and people like you, a leader, can have some influence and beyond your individual congregation. And I think there's one other thing I want to point out from your response. It's not just the flu shot. You described it was connected up to other health fair activities and food access activities. Um, I think that's actually a really important thing to do. Getting your vaccinations is important, but there's a lot of needs out there, health-wise and social determinant of health, and you've really been a leader there as well.
Thank
I,
you.
I really, so Dr. Cook, I want to hear about what you're doing in your practice to protect your patients from the flu?
I think the first thing is to lead by example. And so I was really proud to get my flu shot at my alma mater, Morehouse School of Medicine, by the medical students there. And not
Oh,
only did I get my flu shot by the medical students, but I also documented it. So, now we're in the age of social media, and this is where a lot of people get their medical information from. And so I do have a photo of me getting my flu shot from the med student. We're doing a big thumbs up at the end and showing that I'm making mistakes. I would never want to recommend to others something I wouldn't recommend for myself or for my own family members. But that shows me that I have skin in the game, that I'm willing to do this well and help me show you that you can do it too. So I think social media has been the biggest venue for me to be able to talk about the flu shot, to answer some questions about concerns that people have about the flu shot, address the hesitancy about the flu shot. I also do that in my patient newsletter. So sometimes you hear it one time, but usually need to hear it a couple of times before it clicks. And so multiple times, especially as we're leading into flu season, I'll repeat, remember to get your flu shot. Here's a picture of me getting my flu shot. Have you gotten your flu shots yet? So those frequent reminders really help emphasize the importance of this issue, and I think help people feel safer about getting the shot.
so walk me through a day or a visit in your practice, even up to today, January, mid-January. What's the flu promotion giving kind of a series of events that happens in Dr. Cook's practice?
So I would say I have to start off in saying I have a huge challenge in my practice, and that is I have a private practice I started again because the largest health system left the community, so I had to stand up a practice very quickly. And being able to offer vaccination is a huge hurdle just as far as expense for a practice, and I did not have those resources when I started my practice. So I hate to say that this is the first season that I have not been able to give a flu shot in my office. It really pains me to say that. Now, the benefits I have is directly next door, we have a pharmacy, and I've partnered very tightly with them to make sure that my patients get VIP access. When they get to that pharmacy, they can get their flu shots there. So I make sure I have avenues for my patients to get their flu shot. But I do think there's some lost opportunity not being able to do it here in the office. What I love about my practice, though, is that I've designed my practice to really honor and protect the doctor-patient relationship. I think in healthcare nowadays, that relationship is not valued, and it's routine to have 15-minute appointments. So for the most sacred, important, critical things in health, it's boiled down to 15 minutes of FaceTime with your doctor, and you're lucky if you can 15 minutes. Here I spend 30, 60, 90 minutes with my patients, and we can really delve into the issues. And people come in here and tell me all kinds of things. They say, you know what, Dr. Cook, my aunt got the flu shot and she was sick for weeks. Or I heard you can get paralyzed from the flu shot. Or, I don't want to get the flu shot because it's going to make me sick and I can't call out of work this week. So people can finally talk about what their fears are in a way that's non-rush, in a way that I can have time to be open to hear what they're telling me and to really address their issues head on. When I worked in the traditional primary care space, I had 15 minutes. And when people would say something like that, you didn't really have the time to really delve into and address their concerns. So we spend a lot of time here addressing concerns, encouraging, giving a lot of a positive feedback about what it means to get your flu shot. And then when they do and they send me their pictures or they send me their receipt from the pharmacy saying they got the flu shot, just giving all the encouragement, big thumbs up. Not only does it help protect you, but it helps stop the spread of flu in the community in general. So I really try to make sure that people are encouraged, that their fears have been assuaged, and that they get the good positive reinforcement from taking action.
I really thank you for opening up about not being able to vaccinate this year. There are many practice sites that, for one reason or another, can't vaccinate. But that doesn't mean you can't facilitate vaccination in your patients. So I love how you built this relationship so that your patients are the VIPs at the next door pharmacy. That's
Right.
great.
They can't walk out of there without getting their flu shots. If they go in, they've already been queued up, they know the deal, and they're ready for it. They're pulling up their sleeves, really excited about being able to stop the spread.
That is great. So I'm going to ask both of you. Let's say that I am someone who just does not believe in the flu vaccination. They're trying to put these things in my body that are gonna, affect me in negative ways, and the flu's not so bad after all. Give me your best speech of what you would say about, well, Laura Lee, here's the issue. Let me hear what you would say.
Excellent question. I think the first question for me is to ask more about where that patient is coming from and really speaking to that issue. So you mentioned some great points of, I don't believe in the flu shot. It's going to put something in me that's harmful. It's not that bad. And validating people's concerns. So as I mentioned at the start of this, for most people, flu isn't that bad. I mean, it does make you sick. I tell people, you're probably going to survive it. You're probably going to do fine, but at what cost? So for some people, I talk to them about the lost opportunity. Many people have to call out of work. If you're sick, you just can't work. And how much lost revenue have you lost just because you didn't get your flu shot? So yeah, you're at home sick, but if you can't recoup that loss, that's really difficult. The other thing is you might be healthy, but who else do you have contact with that may not be so healthy? So I had a patient who didn't want to get her flu shot, but she owned a daycare. And my heart stopped. I was like, you're taking care of precious children. I told her, I was like, you know what? I love you and I understand what you're doing, but if I found out that my daycare director didn't get a flu shot and I'm taking my child to you, that shows me that you're not taking care of yourself to make sure that your community is protected. So yeah, you might do okay, but this 4-month-old baby doesn't have the immune system that you have. So speaking to where they can have an impact in their community, they may have an elderly person at home or someone who has chronic illness at home where, yeah, you might be okay. But do you really want to feel like you've done everything you could to protect your loved ones around you? I think the other thing I talk about is, as your doctor, I know what's behind the curtain. So you may feel healthy, you may be asymptomatic, but I know that our diabetes is not quite where it needs to be, or our waistlines are a little bit bigger than they need to be, or you're still having a hard time quitting smoking, and those things are okay. We'll work on those, but get your flu shot because those background conditions means that you can get really sick from flu. So yes, while some people without health conditions may get over this pretty easily, you're not that person that should take a chance. So I really try to speak to what is their specific situation and where the flu shot is going to benefit them.
Boy, I wish you were my doctor.
Still accepting new patients. If you want to come down to Atlanta, there's room here.
Well, Pastor Hamner, I don't know if you find yourself in a situation of talking to individuals who may be reluctant or don't believe in the flu vaccine. If you do, how would you or do you address it?
I'm kind of like the doctor, personal testimony works best. And so, saying that, nothing's happened to me. I've avoided being sick. Um, don't put other people at risk. It's not just about you. It's about other people that you may come in contact with or have care of and that type of thing. You got to weigh the risk versus the reward. Is it worth perhaps getting sick, being down for a longer period of time as opposed to being able to keep doing what you need to do to live your life. So that's kind of the gist of the conversation that I would have. Not quite as in depth or in detail because I'm not the doctor. I don't have all the information behind the curtain. But nevertheless, we just try to encourage people to take care of themselves as best they can.
You guys are amazing. So I need to come and hear you preach, Pastor Hamner. I probably can do that online, huh? I'm going to
You
look
can,
at it.
you can.
You guys are such great exemplars of leaders and health champions. I'm really going to kind of bring this to a close. If there are any last message you'd like to share with your peers or the people that you take care of as in your congregation or your patients about the flu shot this year in the January, let me hear your final thoughts and words that you would share with peers and your congregation and patients. You want to go, Dr. Cook?
Sure. I would say, as we started saying, it's not too late to get your flu shot. So we're in early January right now, and flu has hopefully had its peak, but we often see a second peak kind of in the February, March timeframe. So I've diagnosed flu as late as into April. So when you get your flu shot, about 10 to 14 days later, you start developing those antibodies that are going to protect you. So we're just in time to make sure that you're covered by February, when we're expecting kind of that second peak of flu to take off. So if you feel like you've missed your window or missed the mark, it's certainly not too late. I do, in general, encourage my patients to get their flu shot. The deadline I usually do by Halloween, so when we go into the next flu season, I try to get it in by Halloween. So that way you are fully protected by the time we get to that, December, January peak and that late February, March peak. So earlier is better, but just because it's not October anymore, you can still get a flu shot and still protect yourself and protect your family.
Pastor Hamner, can you close us out with any last words on the flu vaccine and health equity?
I would say get the shot, get involved, and it's not too late to keep yourself safe. So that would be my encouragement to everybody. Definitely need pastors and churches to get involved, as we're in the business of the cares of the souls of men, and that includes their health care as well.
Amen to that. Um, I want to thank both of you for everything you do to make this world better and to promote health equity, and for your time today. Thanks so much, everyone, for watching too, and go get your flu shot.